Good afternoon, everybody, and welcome to these community chats. I think it's the first time that we're talking about measles. It's not the first time that we're doing something with immunizations, but it is definitely the first time that we dedicate the whole community chats to measles. And as you might know, it's very important, especially here where we are located in Rockland County, because measles has been expanding, and not just here, but just historically, I think that we are getting to numbers that we haven't seen in a long, long, long time. But to be honest with you, I'm not the expert on measles. As a matter of fact, I know very little about measles, and for that reason, we have our speaker of the day, Melissa Dieudonné. Did I say it right?
You did.
Oh, perfect. I'm trying to, that's French, right?
It is French,
Yeah, I'm
yes.
trying to practice my French lately. So you have no idea. I'm so happy. Anyway, Melissa is here it's a public health professional with a master's of public health in epidemiology. She's currently the Immunization Action Program Coordinator at the Rockland County Department of Health. She has extensive experience in immunization programs, disease investigation, community outreach. So she has led the Immunization Quality Improvement Initiative and investigated vaccine preventable diseases and delivered public health education to the diverse communities. So she's done a lot around immunizations. And of course, she also speaks Haitian Creole and French. Thank you so much, Melissa, because I know you have a deep commitment to advancing the health equity and disease prevention, especially of our Rockland community. So welcome. And I don't know if there is something that you want to add to that introduction, maybe a little bit
Mm,
about your department and what your department does.
I'll get into that in my presentation, but I've been
Perfect.
here with the department for about 3 years, so we'll get into a little bit of what we do and how we try to protect the community from vaccine preventable diseases.
That's
Yeah,
excellent. So if you don't mind, you can start sharing your
sure.
screen right now.
Can you see my screen?
Yes.
Perfect. All right, good afternoon, everyone. Thank you for having me, Sandra. My name's Melissa, and as Sandra mentioned, I'm the Immunization Action Program Coordinator at the Rockland County Health Department. Today, I'll be giving a talk on the measles virus, and we'll also go over what measles is and how it's spread, measles symptoms and who is most at risk, and its potential health complications. We'll also review the history of measles in the United States and examine the current measles landscape. Lastly, we'll discuss measles prevention, both at the individual and community levels. I want to start by reading this quote by Michael Specter. He made a very poignant quote saying, why do people refuse to vaccinate their children against measles? In many cases, because they have never seen the measles and have no idea what it might do. A lack of personal experience with the severe complications of measles leads many to underestimate the disease's risks. So why are we even talking about measles today? Measles is not just a childhood rash illness. It is one of the most contagious diseases we know. Even though it is vaccine preventable, outbreaks continue to occur when vaccination rates drop. Therefore, prevention is truly a community effort. So what exactly is measles? Measles, also known as rubeola, is caused by a virus that spreads through respiratory droplets and can linger in the air for up to 2 hours after an infected person leaves the room. The airborne transmission is what makes it so dangerous. And it can also lead to serious complications in most vulnerable populations. As I'm going to say this a lot, it is highly contagious. It spreads through the air when an infected person coughs or sneezes. You could get measles just by being in a room where a person with measles has been. And again, this can happen even up to 2 hours after that person has left. If someone with measles enters a room with unvaccinated individuals, up to 90% of susceptible individuals can become infected. Importantly, People are contagious about 4 days before the rash even appears and 4 days after. How does measles compare to other infectious diseases? Measles has an order of magnitude far greater than seasonal influenza. Measles virus particles emitted through coughing and sneezing can stay airborne for hours after an infected person leaves the room, making it easy to become infected even if you haven't interacted directly with someone with measles. The reproduction number, or the average number of people who get sick from one infectious person, is around 15 and can be as high as 18, meaning a single person with measles can infect an average of 15 other people. Comparatively, the reproduction number for COVID and flu is just 1 to 2. So if you look at this figure here, you could see that a single person who has measles infects another 15 people, and each of these 15 people can infect 15 people, multiplying the number of people who are infected exponentially. The incubation period for measles, which is a time from exposure to the virus to the onset of symptoms, is typically 10 to 14 days, though it can range from 7 to 21 days. Symptoms of measles usually start 7 to 14 days after exposure. Measles typically begins with a high fever, cough, coryza, and conjunctivitis, known as the 3 Cs. 2 to 3 days after symptoms begin, Koplik spots may appear inside the mouth. Measles rash appears 3 to 5 days after the first symptoms, and it usually begins as a characteristic red maculopapular rash on the face, at the hairline. Then they spread downward towards the neck, trunk, arms, legs, and feet. These small raised bumps may appear on top of the flat red spots, and they can become joined together as they spread from the head to the rest of the body. When the rash appears, a person's fever may spike to more than 104 degrees Fahrenheit. Measles can cause serious health complications, especially in children younger than 5 years old and adults 20 years or older. And 20 years and older, pregnant women, and people with weakened immune systems. Common complications are ear infections and diarrhea. However, some people may suffer from severe complications such as pneumonia and encephalitis, which may lead to hospitalization and even death. About 1 in 5 unvaccinated people in the United States who get measles is hospitalized, and as many as 1 out of every 20 children with measles gets pneumonia, which is the most common cause of death from measles in young children. And one out of every 1,000 child who gets measles will develop encephalitis. This can lead to convulsions and leave the child deaf or with intellectual disability. And although rare, measles can cause death. Nearly 1 to 3 every 1,000 children who become infected with measles will die from respiratory or neurologic complications. Measles can also lead to complications in pregnancy. If you are pregnant and have not had the MMR vaccine, measles may cause premature birth or cause you to have a low birth weight baby. The long-term sequelae of measles is subacute sclerosing panencephalitis, which is a very rare, fatal, progressive neurodegenerative disease of the central nervous system. It results from a measles virus infection acquired early in life, and it can leads to severe cognitive decline, behavioral changes, jerking, and death, usually within 1 to 3 years. SSPE generally develops in 7 to 10 years after a person had measles, even though they have fully recovered. The risk for developing SSPE may be higher for a person who gets measles before 2 years of age. Fortunately, since measles was eliminated in 2000, SSPE is rarely reported in the US. Okay, make sure. There is no specific treatment for measles. Caregiving should focus on relieving symptoms, making the person comfortable, and preventing complications. So you could make sure the patient drinks enough water and treatments for dehydration to replace any fluids lost during vomiting or diarrhea. The World Health Organization recommends vitamin A for all children with acute measles to reduce the risk for further complications. And doctors may also prescribe antibiotics to treat pneumonia, ear or eye infections. Post-exposure prophylaxis for people who have been susceptible individuals exposed to measles consists of MMR vaccine within 72 hours of exposure or immune globulin within 6 days. Measles immune globulin is derived from donated excuse me, donated human blood plasma and contains antibodies that provide immediate short-term protection. It is prioritized for individuals at high risk of severe complications, including infants under 12 months, pregnant women, and severely immunocompromised individuals. Post-exposure prophylaxis is designed to prevent or lessen illness in unvaccinated individuals or those without immunity. So now we're going to do a brief review of the history of measles in the US. In 1912, measles became a nationally notifiable disease in the United States, requiring healthcare providers and laboratories to report all diagnosed cases. In the first decade of reporting, an average 6,000 measles-related deaths were reported each year. A vaccine became available in 1963, and everyone was recommended to receive one dose. In the decade prior, that's because in the decade prior, nearly all children got measles by the time they were 15 years old. Then in 1978, the CDC set a goal to eliminate measles from the US by 1982. Now, although this goal was not met, widespread use of measles vaccine drastically reduced the disease rates. By 1981, the number of reported measles cases was 80% less compared to with previous year. In 1989, outbreaks among vaccinated school-age children prompted the recommendation of a second dose of MMR vaccine for all children, and measles was declared eliminated from the US in 2000, which meant the absence of continuous spread of disease was greater than 12 months. However, in present day, sporadic outbreaks continue to occur in areas with low vaccination coverage. Achieving measles elimination status in the US was a historic public health achievement. This figure illustrates how common measles was before vaccines and how vaccine policy enabled an elimination. So you could see here, after the vaccine was introduced, there was a dramatic drop in the number of measles cases in the United States. Unfortunately, declining vaccine coverage has led to a resurgence of measles cases in recent years. Most notable are the measles outbreaks of 2018, 2018 and 19, which I'm sure all Rockland residents are very familiar with, and last year, 2025, and current outbreaks persisting through this year. This figure illustrates yearly measles cases from 2000 to present day. As you can see, there have been quite a few measles outbreaks since measles was declared eliminated in 2000. First real spike was in 2014, where there were 667 confirmed cases across 27 states, which was the highest number of cases in 20 years at the time. The outbreaks were largely driven by the importation of the virus in pockets of low vaccination rates. Then again, we saw a spike in 2018, where there were 381 cases confirmed in 28 jurisdictions. Then in 2019, there had over 1,200 total cases confirmed in 31 states. And the majority of these cases were among people who were not vaccinated against measles. And unfortunately, the epicenter was in New York City and Rockland County, where the median age of cases was between 3 to 4 years, with 81% of cases younger than age 18. And again, and I'm sure if you read the news, you've heard about it, just last year, there were 2,281 confirmed cases reported by 45 jurisdictions, and 93% of these cases were unvaccinated. 11% have been hospitalized, and most hospitalizations occurred in cases younger than 5 years old. And unfortunately, 3 people died. And as recent as February 26th, there has been 1,136 confirmed cases reported by 21 jurisdictions. Again, most cases are occurring in people who aren't vaccinated, with 92% of cases being unprotected against measles. This is just a map of the measles cases among US residents. This is for the year 2025. The measles outbreak of 2025 in the US was the most severe since the disease was declared eliminated in 2000. And the surge saw over 50 outbreaks with major clusters in South Carolina, Texas, New Mexico, Arizona, and Utah. This is just the same figure for 2026. Currently, there are measles outbreaks in South Carolina, Utah, and Florida. As of February 27, 2026, the South Carolina Department of Public Health is reporting 985 cases of measles centered around Spartanburg County. Majority of these cases, again, are unvaccinated and younger than 18 years old. And in Utah, as of March 2nd, they're reporting 355 cases of measles, 307 of which are unvaccinated. Again, most cases are under 18 years old, and the current Utah outbreak is linked to a major ongoing regional outbreak involving Southwest Utah and Mojave County, Arizona, where cases surged in late 2025 and continued into 2026. And in Florida, as of February 26th, they're reporting a total of 107 confirmed measles cases. This is because a notable outbreak occurred at Ave Maria University, where 20 students had measles. And this outbreak is primarily affecting young adults, with cases reported in individuals between 20 to 24 years old. To date, total US cases are up to 1,136, 24% of which are under 5, 57% are between 5 to 19 years old, and a whopping 92% are unvaccinated or have unknown vaccination status. Currently, there are no deaths being reported. Vaccination is the best protection against measles. The MMR vaccine has an excellent safety record and strong effectiveness at preventing measles. The first dose is given between 12 to 15 months, but can be given as early as 6 months in an outbreak setting or prior to international travel where measles is widespread. The second dose is given between 46 years old, which is the age of school entry. Catching up is safe at any age. So even if you're past 6 years old and you don't have your 2 MMR, you can get it at any age. These doses give the best protection, with 1 dose of MMR being 93% effective and 2 doses is 97% effective. MMR vaccine protects you and people who are unable to get vaccinated because they are either too young, younger than 6 months, or pregnant or have weakened immune systems. So if 2 doses of the MMR vaccine is 97% effective, why do outbreaks occur? In communities with high vaccination coverage, which is above 95% coverage, 95% or more, the virus has a hard time spreading. So when more than 95% of people in a community are vaccinated, most people are protected through community immunity, otherwise known as herd immunity. However, when coverage drops below 95%, the virus can find susceptible individuals in pockets of communities, causing outbreaks. Declining vaccination coverage, fueled by misinformation and vaccine hesitancy, has led to a resurgence of measles cases in some areas, falling below the 95% threshold. Given the large global measles burden and high communicability of the disease, travelers could be exposed to the virus in any country they visit, particularly where measles remains endemic or where large outbreaks are occurring. Measles is not a seasonal virus. However, it is often spread over times of high travel, for example, during spring break or holidays, or in situations where unvaccinated persons are in close quarters. So schools, daycare, summer camps, large gatherings. Unfortunately, vaccination coverage among US kindergartners has decreased over the years, falling from 95.2% during the 2019 to 2020 school year to 92.5% in the 2024 to 2025 school year, causing outbreaks across the US in communities with MMR coverage below 95%. This data is based on data reported to the CDC annually by the states. Just want to zero in on New York. MMR coverage among New York kindergartners is currently at 97.8%. However, at local levels, vaccination coverage may vary considerably, and pockets of unvaccinated people can exist even in states with high vaccination coverage. When measles gets into these communities of unvaccinated people in the US, outbreaks can occur. Unfortunately, Rockland County has one of the lowest coverage rates in the state. As of January 2025, only 62% of Rockland County children have received one dose of MMR vaccine by age 2. I do want to issue a caveat about this data. This data is pulled from the New York State Immunization Information System, where they assess coverage rates of the initial vaccine series by age 2. And this report is based on immunization data reported from pediatricians that make it into NICES. So it's not inclusive of children whose records are not in NICES. So what have we been doing as a community to try to prevent measles spread? The Rockland County has been working diligently to ensure the community is protected and that vaccines are available for all. As the immunization program, we work to protect the community in several key ways. We host pediatric and adult vaccination clinics to make immunization accessible to everyone. We provide education about recommended vaccine schedules so families can make informed decisions and stay on track. We ensure compliance with state immunization requirements by reviewing records and conducting audits in schools and childcare settings. We collaborate closely with local healthcare providers to improve vaccine coverage and promote on-time vaccination. We also partner with community organizations to expand outreach and education efforts. And when disease outbreaks eventually occur, we respond quickly by identifying those at risk and helping people get vaccinated to prevent further spread. So the Rockland County Department of Health participates in both the Vaccines for Children and Vaccines for Adults program, which are federally funded programs that provides vaccines at no cost to eligible children and adults. We do have clinics in 2 locations, one being in Pomona at the Robert L. Yeager Health Center. Pomona clinics are held every Monday and every other Tuesday and Wednesday at 8:30 to 11. And in Spring Valley, we're located at 14 South Main Street. Clinics on Thursdays between 8:30 to 11. We carry all the ACIP recommended vaccines for children and adult, and our clinics are by appointment only. So you could contact us should you need to get vaccinations, and we can go over your eligibility to get vaccines at our VFC or VFC clinics. We also participate in a lot of community education initiatives. We're at a lot of health fairs and community events. We also do provider trainings. So what can you do to protect yourself and your community? Firstly, you could get vaccinated and stay up to date. 2 doses of MMR for children and adults should ensure they are fully vaccinated or have proof of immunity. Vaccination not only protects you, but also contributes to herd immunity, which protects infants too young to be vaccinated, pregnant individuals, and people who are immunocompromised. Number 2, you can check your immunization records. If you're unsure about your status, review your records, contact your healthcare provider, and when in doubt, getting another dose of MMR is completely safe. Number 3, You should stay at home if you're sick and call your healthcare provider before going in so they can take precautions and prevent spread. You can also support community vaccination efforts by sharing accurate vaccine information, encouraging friends and family to stay up to date, and supporting school and workplace immunization compliance. Lastly, should follow public health guidance during outbreaks. During an outbreak, local health departments may recommend early vaccination for certain age groups, temporary exclusion from school, work for unvaccinated individuals, and post-exposure prophylaxis to prevent community spread. Measles spreads easily and can pose serious health complications among the most vulnerable, but it is also highly preventable with strong community immunity. The most single important action you can take is ensuring you and your household are fully vaccinated. Thank you for learning with me. I know this was a quick talk. Prevention starts with knowledge and ends with action. I'm happy to take questions, and you could also reach out to us anytime to learn more about our clinics and immunizations.
Well, thank you so much, Melissa. This was very informative. You know, usually this is how I work. Like I'm starting to listen to you and I start writing down questions, and you pretty
Yes.
much always answer the questions on the next slide.
Oh, I'm glad to hear
So
that.
yeah, that was really, really good. So to our attendees, you know, this is the time to start writing your questions in, and again, use the Q&A feature, use the chat. I'm gonna be monitoring that. Um, few questions for you, Melissa.
Yes.
After you get measles, can you get it again?
Breakthrough infections do occur, although rare. Yes, it's a possibility.
Mm-hmm. Okay. And can you be a carrier and you don't know?
Well, you can spread the virus 4 days before the rash appears. So you may have symptoms and you think it's just a cold or the flu, and it's actually measles that you've been spreading. So I want to say err on the side of caution and say yes.
Okay. And the manifestations, are they the same for adults and kids?
For the most part, yes, but is more severe in children and adults 20 years or older.
Okay. Okay. Um, if you can go back to slide 7,
Slide
I
7.
thought that was so
Gotcha.
interesting how you said that it spreads compared to like COVID and other diseases. Yeah. So for example, you said, you know, for one person with measles, 12 to 18 can get it, correct?
Yes.
But how is that? Like, can you elaborate on that a little bit? Like in my head, I can not differentiate like how it happens. And maybe it's because you're comparing this with COVID, right? And I feel that, okay, you have COVID, let's say you cough or sneeze and it might spread, but why is it more contagious with measles? Do you know?
Um, Honestly, I'm not sure how to answer that question. But I think it's just the um communicability of the virus itself.
Okay.
Yeah.
Yeah, well, it says here in the chat from Dr. Punjabi,
Oh,
actually.
there she
Thank
goes.
you for
She's a physician.
joining
Yeah.
us,
Hi,
Dr.
Dr.
Punjabi.
B.
Yeah, infections occur in those who have been vaccinated, but very rarely, mildly, and only if they have heavy exposure. I guess it can happen again. They don't occur in someone who has had measles. They can never get measles again. Okay, I'm not sure if I read this the right way. Dr. Punjabi, let me know if I can make you a host,
There you
because
go.
I'm sure that you have a lot to say here because you're an expert. Okay, give me 1 second. Thank you so much. She has accepted the invitation. Give me 1 second. That's great. We got help here. Yay.
Yeah, I'm not a physician, so.
Yeah, no, absolutely. That's why I love these, you know? There you go.
Okay. Hello?
Yes.
All right. Hi. Melissa, great job. I just wanted to clarify. I don't know if I misheard, but I think there was a question of if somebody has had measles, can they get measles again? I don't know if I heard that question right.
Yes, that
Um,
was the question.
yes. And then Melissa spoke about breakthrough infections. So I just want to clarify, breakthrough infections are something that occur in somebody who has been vaccinated, and they end up with measles.
Mhm.
But to emphasize, that would be a very mild disease. They don't spread it a lot, and it's very rare for that to happen, and only happens if there's a very heavy exposure, which like body fluid exchange or something.
Mhm.
If you had measles, you will not get measles again. That immunity is lifelong. But of course, if you get measles, that could be very dangerous, which is why we say vaccination is better in that circumstance. Yeah. And I didn't catch the question on COVID. If you want to repeat that, I can try to see if I know the answer, although I may not.
Yes. Well, I was just trying to make a sense of this slide here, like how come like measles can spread to so many more people than like, let's say COVID as it compares here. Like,
Mhm.
you know, in my ignorance about
Mhm.
immunizations and infectious
Yeah.
diseases, I
Yes.
I always thought, you know, like, okay, if I sneeze and you get a spread, I might give it to you. But
Yeah.
then this is putting things in a different perspective. It's like, okay, it's not as simple as I just got it. There is also like a number of people that can get infected. So how does that work?
Yes. So like Melissa had said, there's several factors which are reason for this. One is just the nature of the virus itself. Um, Measles is very easy to spread, and the natural immunity to it, the body's fight against it or clearing of it, is not very effective. COVID is something that you can take in or inhale, but then you have some natural barriers that can stop it from ever taking hold of your system. Um, the other thing too is oh my god, the vaccination status. Like COVID, the vaccine doesn't give you permanent immunity. With measles, you get permanent immunity. And lastly, the mode of spread. So when we talk about bacteria or viruses, they spread differently. COVID is spread primarily through contact. So you have to be near somebody with their secretions going into you, can spread through your eyes. But COVID does not remain in the air for a long time, right? So if I have measles, on the other hand, I go into a room, even if I leave the room, that measles virus remains suspended in the air for 2 hours. So that factor of measles is very important. Melissa said that even if you are not in touch with somebody with measles, you go into a grocery store, somebody was there 2 hours ago with measles, you never even see the face of that person. If you don't have immunity, you could get measles. So that's a huge factor in why measles is so contagious.
Wow. Yeah, that's definitely a very good point. And it's scary as well to learn that. Um, and why are the immunization rates going down? I mean, this information is definitely key for the public to understand that measles is a serious disease. It is preventable. And however, the immunization rates are going down. Why do you think is that the case?
Melissa,
Um,
you want to take that one?
yeah,
Yeah.
yeah, sure. I'll take it. Um, well, with the internet, information is available to anyone who kind of wants it. And people are, if they're on the internet a lot, they're reading things. And although these things might not be founded in facts or have supportive documentation that proved to be true, people take it in, the information and run with it, and that leads to vaccine hesitancy. So some people might choose to get natural immunity from measles. They'd rather get the measles than get a vaccine, which is a something manufactured, but they often don't think about the potential health risks that come with getting measles.
Mm-hmm.
So
Mm-hmm.
they rather defer to get natural immunity than get a vaccine.
Right. And I
Yeah.
guess in this case, being manufactured, as you say, is a plus because it might not be as deadly as the real
Right.
one.
It is, yeah.
Yeah,
It's a weakened virus.
exactly. Um, if by law in New York State, all children attending schools have to be vaccinated, how come
Yes.
we still have kids that don't have the vaccine? Like, how do they even make it to school? Like,
That's a loaded question. Unfortunately, we've been seeing a lot of falsified immunization records, so that's
oh,
an
yeah.
avenue. Some people might be using medical exemptions to circumvent getting the vaccine as well. So,
Okay, I don't want to know what
yeah.
they are because I don't want to give that information to
Yeah, no.
so they don't use them. Yeah, but okay. No, I was wondering, it's like, how do you even get to school if you don't have those records?
Right.
But yeah, of course, so people are just making fake records. Melissa, you
Mhm.
spoke that there are some countries where measles are endemic. And you also said
Yes.
that people can travel, get measles somewhere else outside the country, and then bring them back here. Do you
Yeah.
have any idea which countries are those? I feel like I don't want to travel there anymore.
I can find out really quick. Um, well, for off the top of my head, measles is in Israel. Is there some parts of the UK, Canada has been having measles outbreaks as of recent. I think some parts in the Middle East have measles as well.
Okay.
Yeah.
I know there is a hesitation about vaccines in general. Let's not talk about just measles, but people are hesitant of taking the COVID vaccine, many different ones. In your opinion, and Dr. Punjabi, since we have you here, I really would like to hear your thoughts on these. What can we do to help change those people's minds to help them realize how important vaccines are, not just to protect your loved ones, but everyone, people in general?
Um, well, from experience, I think instead of trying to force vaccines on people, we should first understand where they're coming from and what is the root of their hesitancy, and then we could counter that hesitancy with facts and how vaccine has protected and has prevented so many illnesses and lessen the burden of vaccine preventable diseases in the US and worldwide.
Dr. Punjabi?
Yeah, I definitely agree with Melissa. That is the foremost thing. Is understanding first what leads to the hesitancy, because it's not one issue for everybody. There is a spectrum of vaccine hesitancy too. Like there are people who are never gonna have it, and just no matter what you do, it's not gonna change. But most people are just hesitant. They just need more information about why it is necessary to do it, and the safety. And then there's people who just want to delay it because they,
Yeah.
ironically believe that, oh, this is too much for my baby. My baby is too young. I don't want to put so much injections in them. But that's counter to what we believe as medical professionals, because they are so young and because they are so susceptible and vulnerable, and we see the highest complication rates in them, that is exactly the group we want to vaccinate. But their thought process is the opposite, right? So it's really first understanding, as Melissa said, what is going on, and then trying to slowly correct that. Vaccine doubts are very easy to plant. Correcting them takes a
It's hard.
long time, and it's hard, and it's a lot of work, and it's collective action, from us as professionals, but also trusted community voices, family members, leaders, all of that.
Mhm. Well, thank you so much. I think, and Dr. Punjabi, I know who you are, of course, but I don't know if our audience knows. So would you like to introduce yourself?
Yeah, so my name is Chitra Punjabi. I am infectious disease doctor. I work for the Rockland Health Department for 5 years now as the director of TB and disease control.
Yes, thank you so much for being here. What an honor. And,
Sandra,
and I'm
thank you,
sure,
of course, for inviting us.
of course, and I'm sure Melissa feels good that you're here. So
Oh,
thank you
yeah.
for
I
supporting.
appreciate the left line.
Melissa didn't really need me. She did a great job.
Oh,
But
absolutely.
happy to be here. Yeah.
Yes, definitely. I mean, I commend all of the work and efforts that you do at the Department of Health here in Rockland County. You guys are amazing. And, somehow if we can help spread this information, it is my pleasure. And of course, we all want to be healthy. This is why we do community chats as well, because we want to bring the facts. I like how you said it, Melissa. We want to bring facts, to people so that they know. And it's true. Social media, can be great for many things, but it can also be not so great for so many
Yeah.
others. So having you guys here and giving the facts to the community really makes a big difference. So I just want to say thank you for everything that you do every day. And of course, thank you for being a community chats, and to our attendees, thank you so much for being here as well. And I will see you next Tuesday in a new community chats. Take care,
Thank,
everyone. And please get
thanks, Sandra.
vaccinated.
Bye.
Bye.
Bye.